Now, the World Health Organization has revealed that depression is the leading cause of mental health conditions in Ghana. This was made known by Dr. Elizabeth Juma, a medical officer at the World Health Organization. She said there's the report reading of the mental health system in Ghana. There's more in this report.
The report revealed that Ghana recorded high cases of mental health during the heightened period of COVID-19. The period witnessed a 28% rise in major depression cases and 26% rise in anxiety disorders.
Having good mental health means we are better able to connect, to function, to cope, and to thrive. And this really became very, very evident during the period of the pandemic that we are just coming through. And disruption in services. People were not able to access the mental health services that they were used to accessing. And these service disruptions, unfortunately, have continued, into 2022 throughout that period. With this, we saw an increase in mental health conditions, including anxiety and depression, by more than 25%.
Head of Psychiatry at the School of Medicine at the University of Development Studies, William Frank Hill Kumsin, called for improved mental health attention for women.
Through the research, we realized that in some facilities, the patient population, we had 60% of the patient population being female. And that means that we really need to start paying extra attention to the female population in our country, because a lot of them are undergoing a lot of stress, and this is manifesting in these high numbers.
Meanwhile, Administrative Director of the Mental Health Authority, Victor Kweku Pesese, said as part of measures to increase access to mental health services, government is constructing 2 new psychiatric hospitals in the northern and Ashanti regions.
You realize that in Ghana, access to mental health services, especially the specialized services, is so skewed toward the southernmost part of Ghana. We have the Accra Psychiatric Hospital, the Ankafo Hospital in Cape Coast and the Central Region, and the Panta Hospital in the Greater Accra Region. We don't have any specialist hospital in the entire middle belt of Ghana, i.e. the Eastern Region, the Ashanti Region, the Western Region, and the then Brong-Ahafo regions, and including the 3 major former northern regions of Ghana, the northern, the upper east, and the upper west. So as part of the Agenda 111 strategy by the current government of Ghana, the government thought it wise to strategically locate 2 of such specialist hospitals, one in the northern belt of Ghana, which is currently located at Tuguyapala in the northern region, and another in Onwe in the Ashanti region of Ghana.
The call for action on mental health, according to the experts, is now. A report by Tracy Asamoah.
So joining us on Zoom is, on phone is Dr. Atwesenya Asu Zong, who is psychiatrist at the Accra Psychiatric Hospital, for some education on this. Doc, grateful that you could join us. What is resulting in this, per your own observation?
Yeah, so thank you very much for having me. And so per my own observation, and from what we usually see at our clinic, this has resulted in a lot of cases of depression, a lot of cases of people who come with anxiety disorders, a lot of cases of people who come with PTSD, marital issues, and all of those things. But it is the current stressful situations that are happening in the economy, in the country, that is accounting for all of them. In psychology, we have what we call an internal locus of control, where if you believe that whatever is happening to you right now, you are the one in control of it, then you are not likely more to be affected by this economic situation. But then we do have a lot of people who believe that it is the external situations that determine what would happen to them internally. And so because of that, such people are more likely to be prone to a lot of mental conditions, like I mentioned earlier.
If that's the case, then a lot of majority of us are going through the same anyway. But if that is it, what needs to be done to ensure that we don't fall into that depression bracket?
So like I said earlier, so, you know, somebody would go into depression, somebody would get into a particular mental illness when they are stressed. And stresses are anything that causes an imbalance in our homeostasis. So these current economic situations, you can classify it as stress. So at this particular point in time, it is the people who have developed certain form of resilience over the period of time who would be able to withstand this. And the people who think that and separate whatever is happening from them and that do not apply it directly to themselves and do not blame themselves for the situation, but rather know that there is really nothing you can do about the economic situation. And what you can do is to ensure that you have sound mental health. And the ways in which we can do that is to ensure that we sleep adequately, is to ensure that we exercise, is to ensure that we go to work and do our barest minimum. You do not have to extend or do things that would overburden you and that would cause you more stresses, because already in the current dispensation in which we find ourselves, there are already a lot of stresses. So as much as possible, you cut back on a lot of things that you have already planned, you have already been doing. Okay. And so we adjust to the situation.
All right. Yeah. Grateful to you, Doc, for the education you've given us. So that Dr. Etwasenya Asu Zong there. Now.